My name is Butch Cantrell, and I'm interested in working in HEMOC, pediatrics, and possibly some form of pediatric psychology. I first heard about evidence-based practice from my wife while she was attending nursing school 10 years ago. The clinical question I wonder about is, how can we maximize the communication and understanding of proper hand hygiene?
My name is Ryan Dunking. I first learned about evidence-based research as I began to take my prerequisites for the various nursing programs I was applying for. I'm interested in pediatric ICU, emergency room, as well as the pediatric HEMOC floor.
My name is Lindsay Tannehill, and my area of interest is the ER. I first learned about evidence-based practice whenever I Googled the highest paid nursing careers, and after CRNA and some other professions, nursing research came up, and so I did a little bit of investigation into that field.
My name is Hillary Thomas, and I am interested in pediatric oncology or in the NICU. I first learned about nurses and research from talking with several friends that have the nursing profession, and it was reiterated to me last summer during our community clinicals. Clinical question I wonder about, since having done rotations in the hospital now, is how can we utilize hand washing more than we do hand sanitizer?
Our population involves patients who currently have C. diff and those who could potentially contract it. A few interventions include continual trainings and education regarding hand hygiene, as well as gloves being worn with appropriate contact precautions and patients' toilets being cleaned with chlorine-based agents.
Alcohol-based hand soap remains the gold standard in most patient populations. However, if a patient is suspected of having C. diff, a spore-forming pathogen, using warm water and soap is the preferred method for hand hygiene. After washing hands with warm water and soap, once hands are fully dried, one can then use the alcohol-based hand soap. Together, this reduces the nosocomial spread of C. diff.
Barriers to implementing hand washing instead of hand sanitizer in the population of patients who have C. diff come down to time and cost. The time it takes to wash your hands with soap and water could be a deterrent from staff. Also, the increased use of supplies such as paper towels, soap, and water bills could deter hospital administration from changing protocol.
Supporting the notion of using soap and water more than utilizing sanitizing gel is that there are sinks in each patient room. The sinks are equipped with soap and water, as well as the wall with sanitizing gel. When someone walks in, they can grab either. However, utilizing soap and water is just successful, and there are no new materials needed to do this. Also, within the medical community, it is known that hand washing with soap and water is better than sanitizing gels, especially in the communication of C. diff.